It's 1:30, Sue.
Great, thank you, Donald. We'll go ahead and get started then. Okay, well, welcome everybody. Thank you for joining the PrepMod training today. My name is Sue Skidmore, and I am going to walk you through the functionality of the system. I'm going to go through the slide deck first, and then we'll go right into the staging environment and do some work over there. So I'm going to walk through these slides first, and then we will get to work. So today we're going to review the home page, which is what you'll see after you log in, and the primary place that you'll be working, manage clinics and users, and then talking a little bit about user roles. I'll walk you through patient registration. We'll talk about clinic operations and inventory. And if there's time at the end, we'll do customized reporting, or we can pick that up another day. And then we'll answer questions as we can, either along the way or at the end. And I'd like to just welcome anybody in Wave 1 who's joining us for the first time today. This training invitation was for the pilot who couldn't make it on any of the other days, and for Wave 1, and we are also training it for the future waves that are coming along behind us. Thank you. So today our objectives is to walk you through PrepMod and its benefits, help you understand the user roles and the key functions, and to respond to your questions. And hopefully you're going to walk away with an understanding of how it operates and how it can help you and support your vaccination efforts. And hopefully you'll come away with a fairly comprehensive understanding of the workflow. And so this is the journey map that we showed you a couple weeks ago, and we have actually progressed quite a ways down this journey. So we've loaded you into PrepMod. We've loaded you in by health district, and then by a local health department or district office. And then everybody's been given one geographic venue location where you might conduct your clinics, and it was a default from your VDH lists. So we'll look at that in just a minute. We will show you how to allocate inventory to your various providers and organizations after you've received it. We've already created local administrative users, and you can then create your own venue users and others below that in the role hierarchy. It's messaged to the various users who we've invited to get signed up for their accounts. And we're going to walk through creating a clinic and some of these other tasks. So we've really marched down this pathway a fair bit. So this is the Prepmod homepage. This is the view of a super user. When you get started, you may not have every single one of these. I believe that the ones that you won't be using are enroll provider or business and enroll employers at this time. So I'll clarify that in a later session. All right, so we're going to talk about adding users. This is where you will conduct your staff registration. And by that, I mean you're going to sign up your staff to go with a clinic. So if somebody needs to be added to a clinic, you'll go in here and add them to a clinic. You'll record various contact name information and other credentials, and you'll manage access here. We'll talk about adding inventory by organization and provider. And then the very first thing we'll do after adding users is creating a clinic, and then we'll walk through the registration and so forth. So let me stop at the user access levels and just talk a minute. The local admin users should be everybody on this call, perhaps. Maybe there's some staff level people that you've invited to listen. That's great. But my comments and my training today are going to be, at least the initial part, fairly focused on getting you guys comfortable in using the system and getting it set up. So local admin users are able to do everything a super user can do with one exception, and that is they cannot grant access above their level. So when we get to that, I'll point that out to you. But you basically, as a local admin user, you own your system. Okay, the regional admins, those are going to be assigned to the 5 regional coordinators, the emergency preparedness coordinators. So John Cook, Michael Keats, Mike Magner, Judy Cooling, Jeff Walker, and we will be going over this with them tonight, and they will be able to help us add local admin users. You're going to hold the rights to everything below that, and the regional coordinators will help us get the various health districts LAUs, as I call them, up account created and up in the system. Okay. This is what the landing page looks like when you send out the private URL. And I'm going to walk you through this again, but this is the patient view. We're going to talk about how you view your registered patients. We may touch on the virtual queue, but that's an optional function, and I don't know that it's imperative to our learning to go over that, but if we get a chance, we'll look at it. Then we're going to walk you through vaccination. We'll look at the clinic activity, and we'll finalize our clinic inventory. And I'm going to escape out of here and get right into the system. So first, I'd like to draw your attention to the two different landing pages, the login pages. Let me log out of here. This system that I'm looking at, this site, is the staging site, and there's a red banner at the top that says it's a staging site, and anytime you look at the URL, you'll see the word staging in it. That reminds you that you're in the staging and you can do whatever your access allows you in staging. It's not going to bother anything. Over here, this is the production site. It says that in the URL, and there is no red banner alerting you to anything. So let's be careful where we're going. There are some things that we can certainly correct ourselves, but we want to be as clean as we can with our two different sites or environments. Okay, so I'm going to log in. It was successful. I'm in the staging area. And the primary place that you're going to begin is under Manage Clinics and Users. It defaults to the clinic listing page. And then there are a number of tabs across the top for navigation. There are the clinics listed down below, and the default listing is upcoming clinics. You can search by a clinic name. You can ask for all of them. You can ask for past clinics or closed clinics, and then you can reset your search. So for example, if I want to look for Alexandria, I can type AEL and I can search, and the Alexandria clinics show up. And then if I want to do another search, I'll just reset my search. And I'll come back in here and I can type in Fairfax and search, and we'll get probably both Fairfax and Lord Fairfax. Anything with a Fairfax in it. Oh, I have FAR or Fairgrounds. Good deal. All right. So that's searching for your clinics. Let's go ahead and create a clinic. Now, let me back up. Let's start in counties and jurisdictions. My apologies. I want to show this to you so that you understand how the system's been built. This has come preloaded as set forth by VDH. The counties and jurisdictions correspond directly to health districts. So you'll find 35 counties and jurisdictions, and we call those health districts. If you click on one, let me just type in some of the ones that I know. Fairfax, if I can spell it. I'll search for those counties and jurisdictions. There's Lord Fairfax and Fairfax. Click on Fairfax, and the organization and providers are direct correlation to your local health departments or district offices. So in Fairfax, they have the Annandale District Office, the Joseph Willard Health Center, the Mount Vernon District, the Springfield District, the Reston District, and the Kelly Square Office. All right, if you need to add an organization and provider, the button over here will be blue and it will be available to you, but it is unlikely that you will need to add too many at this point. Then you can go down to the, let's say, the Joseph Willard Health Center, and this is where you are at venues. Okay, so there are two venues associated with the Joseph Willard Health Center. That physical location, as well as the government center location. If we'd like to add another venue, we can simply do it here. And the venue name might be called Second Dose or @dose, but let's do Second Dose Government Center. Okay. And then we'll give it an address of, I'm not sure if I got that right, but government. I don't know if I have all the names right, but we're getting there. Fairfax, and that'll be close enough. You'll notice that the IIS and registry ID is here. We'll come back to that and talk about that when we're doing inventory management. And then you simply create your venue and your location. And it says, I've been successful. If I didn't have something filled out correctly, it would give me a pop-up message, okay? So that is how we add venues. And that is one of the primary things you're going to want to do right away is get your venues in here. All the physical geographic locations where you're having clinics, where they're physically being held. Then once you've got your venues in there, then you can begin to build your clinics. And so let's type in Fairfax and search and see what they've got going on here, just to see. They have one upcoming clinic, which is today. It's a private clinic. There's 2 people registered. And this over here is another navigation bar for this clinic listing. Now, this isn't really the one I wanted. I'm not in Reston. I want to create a new clinic at the Government Center. So let's go ahead and do that. And so here you'll select COVID-19. And then for now, moving forward, only select the private radio button is the clinic public or private. As we get to open pods, we will have further instructions for you on managing the URL and the registration process. I'm not going to collect insurance information. It's not required. And I'm going to select COVID-19 vaccination and vaccination. And I will come back to that. Nathan, if you want to chime in there, that would be good. I'm going to say it's open to all ages. And then I'll select Fairfax from the list by just typing an F in there. I will type an F in there and I will see that there is the Fairfax County Health Herndon Reston District, Joseph Willard, Mount Vernon, Springfield. I'll select the Joseph Willard and I will look over here and you will see that I have not only a government center clinic, but I now have a second dose government center clinic. So you might consider naming your venues in such a way that it gives the people signing up for them a little bit more guidance than just the name of the location. So that's free to you to do that. Another thing I'd like to point out is the setting. While it's not required, please do click on this and do select that it's a health department, just so that if in the future they decide to use that field for reporting, it's right from the beginning. As you can see, there are a number of different choices, including basically, I guess if there's an other, then you'll have to let us know. But for now, be clear that it's a health department or whatever. And then select the time, the date, time, and the location. So when you select the clinic date, just know that you can arrow back and forth using the arrows at the top. And then if you need to do a different year, the years are contained right in that little scroll bar right there. So when you've found the month that you want to work in, go ahead and select it. And then go ahead and choose your starting time, whether that's AM and PM, and then the end time. And the system will keep you honest. You won't be able to end a clinic before it starts. Wonder how I know. Do you want appointments available? So yes, they're required. Yes, they're optional. No, you're doing just a walk-in clinic. So if you select yes optional, that allows you to both have appointments and manage any walk-ins. And at this point, that might be what most of you are doing, but do give yourself the option until you're familiar enough with the system to lock yourself out of that, okay? Because I think you can edit it when you come back, if you come back in, but we'll take a look at the various things that we can edit once we've created it. Social distancing is how many people can you physically have in your pod, in your point of dispensing. And the system, this does not drive appointments, and the system will ask you again when it uses this if you indeed want to use 5 or if you want to change it. So put in what you think your physical capacity is from a social distancing perspective, but know that at this point it does not come into play in how many appointments get created. Registration deadline. So I created this clinic. It's for February 1st, and I want to allow registrations right up until the day. And I want to allow registrations on the same day so that I can do walk-ins. Now, if you look, the clinic is an 8-hour clinic. I'm going to say that I can do 15-minute appointments. I can process one client every 15 minutes, and I'm going to have 4 people per hour. Actually, let's do 5. I like 5. 5 is my favorite number. And based on the number of hours and the number of appointments that can be done, we have 160 total appointments. So if you think of the appointment slots per encounter length as the number of vaccinators that you have available at that clinic, that helps me. I think that's a good way to view that particular slot. And we will see the appointments, how they're generated when we walk through registration. You can optionally add contact information, including a backup contact person if you feel you need to. And then the additional clinic details is displayed publicly on the clinic listing side. So if you'd like to say, please wait in car until invited in, then you can put that in. Or if you can say, stand in the line over on this street, you can put that in. And then identify whoever the lead clinic staff is. We'll pick Juanita. And this is the place right here, clinic staff, where you're going to enter your vaccinators. So I'm going to enter, let's see if I've already got Millie in here. I might have put Millie in. And she's working today. And then we'll add more staff. And the clinic staff name will invite my cat. And my cat will be a vet. And we'll leave that the way it is. And then this clinic is going to be ultimately administering both Pfizer and Moderna. So I'm going to select both of those there. I'm not going to do the clinic inventory just yet. I'm just going to go ahead and submit this data and create my clinic. Oops, I had one detail that was missing. Appointments available can't be blank. So let me see where I've missed that. Oh yeah, right here. I thought I had selected yes optional. Okay. Nice check to make sure you've got everything the system needs. And then it gives me some positive feedback. I've successfully created the clinic. Okay.
So my apologies.
That's okay.
For, interrupting. I think there are some folks who are trying to get into the meeting. I think they seem to be dialed in. They're not able to get in. I was hoping if Donald could check, because if before you go too far, to make sure that everybody is in attendance. Are you able to see if anybody is like in the waiting room or anything like that?
We have no waiting room. And WebEx does not have a waiting room. You're either in the webinar or you're not.
Understood. Okay. All right. Let me, Sue, why don't you keep going? I'm going to troubleshoot this to get these folks into the meeting.
Okay. Thank you so much. All right. So we've created a clinic. Let's go ahead and find our clinic, upcoming clinic. And in Fairfax, there's 2-1 right there, the Second Dose Government Center Clinic. All right. So let's go back in to View Edit Clinic, because this is where you're going to find the URL, the private URL. It's this field. You do not select anything in that grayed out field. You hit the blue button next to it that says copy paste. And that is the registration link. That is the private registration link. If you send that out to your employers in your phase 1B, 1C contacts, they need to understand that if it gets out into the public, then you're not going to have room for everybody in your clinic. So we need to message carefully when you are sending out your private URLs. Yes, we are working on a way to hide that. That's currently in the queue, but we didn't want to hold up the use of the system. So I'm going to paste that staging private registration link into my open tab. And this is what the system looks like to the person who clicks on that private URL. Okay. Reminds you that Pfizer's for 16 years and older and Moderna is for 18 years and older. And we will type in Helen. There's a lot of Skidmores in this system, so enjoy that, all of you. Let's see, let's take a look at the occupation list. These are all required fields. They're pre-populated. So you can select from a number of them. There is a place to select other. And we'll go there. Date of birth, September 8th, year. We'll just pick a year, 52, and female or other. Now let's talk about email address. It's not a required field, as you can see, but if you can provide one that will allow you to communicate confirmation of the appointment and reminder to come in and that kind of thing. So I'm just going to go ahead and use my personal email and my personal phone number and let it know that it's mobile so they could text me. And we will say 100 Fort Haywood, and we'll save and continue. And now we're on page 2. I don't have any insurance, so I'm going to select no insurance. And then I've got to save and continue at the bottom. Now we're on the health questions screen. And this is the, in the production environment, let me just see, it looks like, yeah, also in this environment. We needed them to be updated. So that was the holdup this morning when I asked you all to not continue with registrations until we got the fix applied. So thank you for your cooperation. So is this your first or second dose of COVID? This will be my first. Nope, this is a second dose clinic. So let's go with second. And then it asks you which brand of vaccine did you receive the first time. So I know I received Moderna. I'm not feeling sick today. I didn't have an allergic reaction, but if I did, it would flag that in the system by letting you see the answers to the screening questions. And if you say, yes, you've received vaccine, some of these have drop-down windows. I'm trying to find one that does. Nope. All right, let's go up here. Was there an allergic reaction? That's not working right now. Okay. Oh, there it is. That's what I was trying to show you. So the severe allergic reaction gives you a drop-down list. I'm going to get back to you guys on these two. I think these were the ones we were working on this morning. All right, so I'll say no there. No to a positive test. Nope. Nope. And am I allergic to goats, frogs, or armadillos as a test question? I really don't know, but that's a fascinating question. All right, so I have answered all the screening questions. I'm going to save and continue. And I'm going to, again, select my Moderna. And then you can either sign your name on a tablet with a finger or mouse, or you can simply type your name in. And then down below, you select the relationship to the patient. And because I selected self, it pre-populated the name. This is my signing my EUA consent, if you will. And this asks you to review the details before you get to the appointment screen. And here we're at the appointments. So I can select, as appointments are saved in the system, when you get down here, when you save and continue, it decrements the available appointments in that time slot. So we'll go to the first one, save and continue. And then it says, thank you for registering, you're confirmed. And if they had put in an email, they would have received an email confirmation about their registration. Okay. Back to the staging area. Let's go look at our clinics. Let's just look at Fairfax. And the Second Dose Government Center. I'm actually going to, yeah, let's keep going here. There's one person registered, and I'd like to see who that is. So let me click on the registration list. You can download your registration list and print it out if you need to. Because I allowed walk-ins, I can add more patients here, so I can register people directly. And then this is the person that is listed, and you'll see that this is the second dose identified. Hover over the question mark, and you will see the screening questions: age, date of birth, gender, appointment time, my occupation, and what type of dose I told the system I had. Okay, you can send me an email reminder if you'd like. You can view my consent, or you could delete the registration. So let me go back. Nope. Okay. No. Okay. So that was the registration. We're not ready to do clinic activity yet. Let's go back. Let's go in and do inventory management before we go any further. Let's allocate some inventory to the Second Dose Government Center venue. So we received it today. The vaccine name, there's a very long list of vaccines in here. So let's just type Moderna or MOD, and it will pop up the basic information, and it will pre-populate the forms fields for you that are associated with that vaccine and the product, the manufacturer, and so forth. In the lot number, let's type in Thursday, 21, expiration date. The field operates the same way as the create a clinic date field. So let's make another expiration date a little ways out. And how many items are we going to get? Let's say 300. Packaging is by unit. The source of the item is other purchase. You can pick if it is private purchase, VFC, or borrowed, but other probably works for most of us at this time. And then you can allocate delivery. You have to allocate the delivery first to your your health district. Then you need to allocate it to your health department. And this one needs to go to the Joseph Willard Health Center and the Second Dose Government Center Clinic. I don't have to add a venue at this point in time. When I receive a delivery, if I don't know the venue, I can leave this blank. You can insert your vaccine information sheet if you want, so people have access to that. And then the EUA Viz publication date, I eventually will all have it memorized. I typically just go back to December, and I pick December 20th because I'm almost certain that's when it was. I believe it got approved on my birthday. So, and then let's go ahead and just create. This is our inventory information. We've allocated it all the way down to the venue location, and let's just create it. And then we'll go and search for it. If I hadn't done it successfully, it would have given me a dialog message letting me know that I had missed something. And it defaults to an empty screen in case you have another delivery of a different lot number that you need to enter. So let's go down here and look for Moderna. And there's a lot of them. So I'm going to go and look at Fairfax and search again. And these are all of the ones for Fairfax. Mine's not there. Let me reset this. Oh, I'm sorry. The way to find the one that you've just entered is by looking at through the lot numbers. So there should be a Thursday 121, and there it is. My apologies. So you can click on the vaccine itself and take a look at what you have. So this is the Moderna vaccine that was received on 1/21. It gives you all the details about it, who it was created by, so you have a trail there. And down at the bottom, it has your various totals, and this is populated as you work through the system, okay? All right. Let's take a look at the clinic. Now we've allocated vaccine all the way down to the venue level. Let's go ahead and use some of that up in an actual setting. Let me just do a quick search again. Yikes, sorry about that. Fairfax. And we'll search. It's not going to find anything. Do you know why? Because I had a manufacturer that I shouldn't have had in there. So let me get rid of that. Okay, there's mine again. I can edit that if I need to. So let's say I entered 300 and I didn't get that right. I can go ahead and edit by coming back in here. Okay, so you just want to be clear what you're doing. This is not the area where you're going to decrement use. This is setting up a receipt of a delivery. All right, let's go in and run a clinic. So we've done the user, we've done the inventory, we've done venues, we've registered. Okay, we're ready to go. And let's go down to this one, the Second Dose Government Center. Let's go ahead and go into clinic activity. All right, so we have one patient registered, Helen Skidmore. This clinic is a 9 to 5 clinic. It's 480 minutes in length, not that we're counting. The comments that are visible to the public on the public-facing website, and then the count of vaccines that you have administered in this clinic, starting doses, and so forth. I must not have allocated my vaccine to this particular venue, or I would have vaccine here. So let's go back and do that. So let's search. And we'll find it. This might not have saved it. All right. So let's check. Let's check that and say edit. Oh, it's there. Okay. All right. Clinic activity. Not sure why. I'm going to walk you through the vaccination process. I'll come back to inventory. I'm going to go ahead and select Helen. Look at her details. I can view her consent, and I can go back to records. And then I'm going to click right here where it says vaccinated, and I'm going to get a dialog window. And I don't have vaccine allocated. So Nathan, are you on the line still?
I am here. Okay.
I don't know why my venue isn't showing my vaccine.
Can you go back to view and edit clinic in your particular clinic?
Yep.
And then right down to the bottom.
Oh, I didn't do it there. I didn't go down far enough. Oh, thank you. Appreciate that. Oh, here we are, Thursday 121. Need to add the item. Thank you. Okay, so that's an important step, as we have all seen. And of the current inventory with this lot number, how many are going to be used at the government center? You can use all of them or you can use part of them. So we'll say 200 are going to be used, okay? And then update. And that's how you assign it to the clinic in the View Edit Clinic field. Okay, right down here. All right, now let's go back to activity. And let's take Helen through the vaccination process. I'm going to select this. There may be multiple vaccines on your list by the time you get further along in the use of the system, so be sure you select the right line that has the right vaccine and the right lot number. You can change, but it defaults to IM for our purposes because that's all we're doing. I'm going to ask to have it in my left arm. I didn't have a reaction. Vaccination date. There's the general reactions. I didn't have any. And then here are the people that are vaccinators in my clinic. I added Millie and Chester, but I had already added Juanita a couple different times. I'll have to take a look at that. So we'll let Chester administer this. And does this complete the series? Defaults to no. I'm going to select yes and update. And then you'll notice our inventory for the venue has 200 starting doses. We've administered 1 dose and there's 199 remaining. I can then go back up here and I can say I had to waste 3 doses, and I can save that and it will save it. And when you get down here, back here, activity form, sorry, defaults to View Edit Clinic. You'll see that I have 196. So I started with 200 minus the 1 I gave and the 3 that I wasted for a total of 196 that are left. Now, let's say you're at the end of the day and you've given everybody in line a shot. You've run out of vaccine and you're closing up shop, and you've got your starting doses, the number of doses administered, your wasted doses, and you've got everything's coming out fine and everything is looking good here, and you've adjudicated that. When you're ready, Save and Submit closes your clinic and it reports your vaccinations to the VIS system so that you are immediately telling the state, hey, I just got done vaccinating 200 people or 2,000 people or whatever you process that day. But that is very important, and you can go ahead and search on your clinics to see which ones you might not have closed, because you can search by closed clinics, but you definitely want to be doing Save and Submit at the end of the clinic day, ideally, so that it's included in the next day's reports. Okay. All right. So that's finalizing the inventory. If I want to view the activity report, I simply click on Activity Report, and I don't think many of us will use export to PDF, but we will probably use export to Excel. And we can go ahead. This is basically what our clinic had, and we can take the data that we're viewing here and export it to Excel. And it typically does the download in the bottom left corner. And it's opening. And you'll see this is all of the people that was vaccinated in this clinic today. Okay. All right. So back home, we've done clinics and users. Let's start a clinic. Starting a clinic, you can open your clinic up, or you can delete from here. So let me just find our upcoming clinic and search. And got a lot. There's my second dose. And I need to go into my clinic activity. If you need to delete a clinic, you'll do it from this screen. And it brings us back in here. And I'm not opening my clinic. Okay. Must be here. All right. Sorry about that. It's all good. Let me reduce that to just the upcoming. All right. Get down here. I'm going to start the clinic. So this is how you'll start the clinic in the morning. So it says it's starting. And it changes, checks you here for the social distancing. And the clinic status right now is upcoming. And if I just go ahead and start, should be updating. I will open it for check-in right here. Open for check-in. And you see it's open for check-in. And I have Helen who's not checked in. So I can check that person in and move them down the queue from not checked in to checked in. And so on. You have a invited list, at the clinic list, a completed list, a pending list in case they didn't arrive in time. So you can take the next person and fit them in as you can, and then any cancellations if you care to use those. So I'm going to pause for a minute. It's see what kind of questions we have. No questions. So go ahead and feel free to jot some questions in the chat if you have any. Nathan, I would invite you to add anything that you would like to add.
Sure, absolutely. I think I'll start with the question that we just got, and I'll go over a few quick items.
Are you going to share screen or should I drive?
No, I can just talk through some of
Okay.
it. So I think first question, if you had to close a clinic due to weather, how would you do that? I think it depends on if you have scheduled appointments already that are on the books. So if you had scheduled appointments and you had to go in and cancel clinic on a particular day, you can go ahead and do that by first removing all the patients who have an appointment. So this would require an administrator to be able to delete the patient records. Now, one thing to note is that PrepMod does not automatically trigger an email or some kind of a notification to the person to come in and reschedule it to cancel clinic. So at that point, what we would recommend is that you download the registration list and send them a private registration URL, assuming you're doing closed pods to sign up for a subsequent clinic down the road. If you're already in open pod at that point, then communication that they need to find another time slot because clinic was canceled on that particular day. Is it possible to set up 2 clinics at a site per day, one for 65 plus and one for all ages? Yes, this is possible. You would create multiple clinics in the system that correspond to a particular venue and then designate them accordingly. Will it be possible to do bulk uploads of individuals like we currently do in VAMS? The answer to that question is no. VAMS supports the ability to bulk upload patients into the system, which triggers, or rather employees, notifications to them. In this particular instance, the answer is no. The private registration links, assuming that you're doing a closed pod, will have to be sent out to the different users. Okay. I'll take a pause there because I think the questions have slowed down, and I think I'll really call out a few things, and some of these I think in terms of some of the things that we've learned, even talking to our counterparts over at VHHA, and a few things to really keep in mind. I think number one is going to be the save and submit. right? Really want to emphasize the save and submit function. For a particular clinic, once you're done with your clinic activities for the day, you vaccinated everybody, you've gone ahead and completed everything that you need to, you go ahead and click on that save and submit button, which is going to be in your clinic activity form. Now, what that does is it closes your clinic at that point in time, and it also pushes the data to the VIIS or the immunization registry. So I think this is a very important function that needs to be completed. If you do the save and submit multiple times over the course of the day, maybe you do it once at lunch and once later, that is also fine. Not a problem. The duplicate data won't be sent across, so everybody will be sent across first on the first save and submit, and then the next time you do it, anybody who didn't get sent on the first time are the ones that are going to go across on that interface. Like Sue is demonstrating right now, you can always come back and reopen the clinic and continue on with your activities. All right, let's take some more questions as they come in. So we will have to manually enter each individual. Area, like looking at just the baseline functionality in PrepMod, and I think this is going to be a little different from how VAMS does it. So in the PrepMod setting, you have the ability to make either public or private clinics. That translates to being able to do open pods and closed pods. So if you're doing a closed pod, then you're going to designate your clinic as a private clinic. And then there is a private registration URL that is produced that is tied to that particular clinic. Now, patients who are looking to get vaccinated will click on that particular link to sign up for a particular appointment. There is no ability to upload patients and schedule them for appointments. You do, however, from a clinic standpoint, have the ability to make an appointment on behalf of the patient. So within the clinic itself, there is the ability to add patients. So I think based on what Sue is showing right now, you see the private registration URL. That's the URL that goes out, that you would send out to people who need to be vaccinated. And then when they click on that particular link, it will take them to the registration that corresponds to a particular clinic.
Hey, I just wanted to jump off of mute real quick, just because I think I can get my questions answered a little faster without typing them. So talking with our other VAMS coordinators and folks, all right, we have a ton of 65 plus, and currently our method was going to be, you know, just doing bulk uploads of those individuals with their information, but we won't be able to do that with PrepMod. Okay, makes sense, that's fine. But what is the strategy you would recommend for those folks? Because as we all know, sending out registration links, even if it's a closed pod, I mean, yeah, what is your strategy for uploading all of the 1B individuals that we're going to have? Because obviously there's a lot more individuals in 1B than there are 1A.
Right. So I think at a baseline, I think baseline, there is no ability to upload them. The approach would be to send them the private registration URL so that they can go ahead and schedule the appointment.
Is that URL going to only allow the person, like, is that URL going to be able to be shared, or is it specific to, so if it's able to be shared, that's the problem we've already had in our district. At one point for a large clinic we had for teachers, there was a link that the district sent out and it was shared. And so is that truly, like, that's the only strategy that's in place for us to register individuals at this time, is just sending a large email with one link in it for them to register?
Right. So I think, and Ariel, I think this question has come up before. We're trying to identify, and one of the things that we're asking the vendor is, do they have the ability to mask the URL. So basically you prevent the ability for somebody to share it. So that's something that we have engaged the vendor on. We don't have a response back, but that's something that we are working with the vendor on. At this point in time, the answer would be yes. If you're doing a closed part, then it would be emailing them the URL and having them sign up for appointments for that particular clinic. That is the current capability in the system right now. Okay.
All right.
All right. Couple of other things that I'll go over. I think one of the things that we heard about specifically with the browser that you're using as you set up clinics. I think using Internet Explorer, one of the things that folks identified was clicking on COVID-19 vaccinations for some reason through the Internet Explorer browser defaulted to vaccinations and not COVID-19 vaccinations. So I think when you create a clinic and you'll see a radio button on top that gives you a few options. One of them is just vaccinations. One of them is COVID-19 vaccinations. And I think there's also testing in there. Yep, the services provided piece. So just making sure that you click on COVID-19 vaccination and make sure you verify it as you're going about creating these clinics. This issue has not been observed on Chrome and Firefox. So that's something to definitely keep in mind as you're working through this. The other piece is, if you scroll down a little bit, Sue, you'll see the different staff that you're adding who are going to be at your clinic. The people that you're putting in here and their associated credentials do show up on the vaccination record. So I think this is something to keep in mind in making sure that you're intentional about who you're putting in here. Because just know that whoever you put in here and then you choose them as the vaccinator goes on the patient's vaccination record that's emailed to them after the vaccination. So I think this is going to be important to be very intentional about who is input in here. Couple of other things that I will call out. I think as your clinics start to grow, I think what you'll start to see is you might have a clinic with 500 people that are scheduled, maybe 400 people show up, and maybe 100 did not. On the clinic activity form, you click on who you're vaccinating as you go through each of them one at a time. But for the people that don't show up, at the end of the day, you might realize that you're in a situation where you have 100 people who did not show up to clinic, and then you have to, go through and click on the radio button for each and every one of them. One thing to know is that even if you don't click on those, click on, absent for those individuals, you can still go ahead and save and submit. So just keep that in mind. You can save and submit as long as you have chosen all the people that got vaccinated. And then, of course, that's the data that goes into Viz. If anybody was absent, they were withdrawn, you don't necessarily have to input that because data is not flowing across. And systematically, it does allow you to do the save and submit. The other piece, I think, just in terms of overall second dose appointments, we're strongly encouraging you to do the second dose appointments after the person receives their first dose. This is something that has worked very well with VHHA. I think this is strongly recommended for us as well to set up those second shots. One of the items that we also heard on that front was naming the clinic as, a second dose clinic to kind of identify that particular venue name and calling it second dose. And I think in Sue's example today, she kind of went through something similar where it was second dose government center clinic. So really, I think that can kind of help keep track of your second dose appointments and having people getting an appointment on the books before they leave after their first shot. Okay. I will circle back to the Q&A. I think we have a couple more coming in here. So first one is, can we see the process for adding in a patient on the back end? Sure, absolutely. So do you want to quickly walk through adding patients from the clinic activity? And I think what you'll see down there, and if you scroll a little further, you'll see the ability to add more patients. What this essentially does is this opens up the private registration URL that ties into the clinic. Still need to go through, providing their demographics, the screening questions that need to be answered. I think this can come in handy when you have a walk-in, somebody, did not have access to technology, they meet the eligibility criteria, they're at the clinic. If you have the appointments and the ability to support them, you can create a record of them in the system. They can sign in the consent, there is a signature needed, so they can probably sign it on a tablet or on your system, and then you can make the appointment for them at that point in time. So it doesn't look very different from just completing what a patient would complete as a registration, but you do have the ability to go in to adding patients from the back end as well. Do you have recommendations on people who receive their first shot through VAMS and now want to switch to PrepMod? How do we move them from VAMS to PrepMod in an efficient manner? I will also, if Marshall's on, I'll ask him to chime in here as well. I think overall, the approach that we would recommend is to do a fresh cutover into PrepMod. So if you have second shots, complete those within VAMS, and then you start people on their first shot PrepMod. I think that would be the cleanest way to make a break. Marshall, I don't know if you have anything that you would like to add on to that.
Hey, Nathan, I think you hit the nail on the head there. That's probably the easiest way to do it, and that's for a couple reasons. One, both of these systems kind of act as a medical record for an individual, and it would be better to have their complete immunization series in one record versus another. And then two, that allows you to kind of finish off all those individuals in VAMS and start closing out VAMS. So what I would encourage is, as much as possible, for you to bring those people that are already in back for their second dose appointments in VAMS, and then use PrepMod moving forward. And we realize that may not be possible for every clinic, but as much as is possible, I think that is the preferred route.
Thank you, Marshall. Sue, I think back over to you.
Okay. All right, I'll let you monitor the questions. I don't know what else you need or want to see repeated, but I'm happy to start again at the beginning. I'm happy to walk you through a look at the production environment if you'd like. The pilot group has already got access to the production environment, and the Wave 1 group 1, I don't have a lot of local administrative user names from each of you. So if you're in the Wave 1, and let me just show you to remind you, this is our initial thought about Wave 1, Crater, Cumberland, Eastern, Henrico, Lenawisco, Loudoun, New River, Richmond, Three Rivers, and Virginia Beach. Please send to me the names, and if they have an email address that isn't straight off of their regular name, like if they use a nickname or something, give me the email address or tell me what the proper name is so I can find them in the system, and we'll get them loaded into the staging area. as you come on board, you get into the staging area first, and then we'll cut you over to production right after that. If that doesn't work for you, please just email me and let me know, okay? All right. Also wanted to cover real quick the implementation schedule to go along with that. Today we are conducting staff training for Wave 1. I don't know, I haven't seen the list of people who have attended, but we'll train you, give you time in the staging environment, and then we go live on Monday. If you really need to be in the production environment, we do ask that you complete a training or listen to the training. So we recorded yesterday's training and we are recording this one. I'm going to take a look and listen at them after this is over, and we will get one posted and available to everybody. And then given the urgency of getting everybody go live, we still want to be able to roll people out in a way that's very supportive. So hopefully we can go live with most of Wave 1 on Monday, but again, we're flexible. And if you really feel the urgency to get into the production environment and you've had training, then just let me know. And my email is sue.skidmore@vdh.virginia.gov. And I will do my best to get everybody in. The other thing I want to point out about the implementation calendar is that PrepMod, the vendor, also provides some training. Now, today's training this morning, they had some technical problems and they've rescheduled it, but this afternoon they would have 3 o'clock the staff operation, and there's a little link to their Zoom. So basically their cadence is a Thursday, Friday cadence. They've only got the schedule out for January, so we have this week and next, but they do local admin user training in one part of the day and a staff user training in the other part of the day, and then they flip it on the following day. So Thursdays, it's admin in the morning, staff in the afternoon. On Fridays, it's staff in the morning, admin in the afternoon. And so you'll see that on these links here in the italicized at the bottom. Wave 1, you go live Monday. We will immediately start Monday with office hours from 9 to 10:30. That's where we'll walk you through whatever you need walking through. We'll answer more questions, and then we'll have another office hours just for Wave 1. So please know the invitations that went out, the invitations were just for the people that I have in those waves. So Wave 1, I will need to have the additional people you want invited to the office hours, added as local administrative users. Then you'll add the rest of your team that are below the local administrative user level. We are purposely not having anything on Wednesday because we're going to continue to have the Wednesday morning meetings from 9 to, looks like 9 to noon now. But somebody's got their mic open. Did you have a question?
So this is Nitin. I think there are a couple more questions that have
Great.
come. I think folks are looking to do a quick, are wanting to see a quick walkthrough of setting up a clinic.
Okay.
I think they can be combined together. I think a few questions just around appointments, setting up a clinic, and going over venues.
Great. Create the venue first.
Yep, I think that would be great to see.
Okay.
And just with the number of questions that we have, kind of baseline this. So the first step really before you go into clinic is always going to be the venue. So you want to make sure you have the venue or the site, and it's a physical location where your clinics are going to be held. And then, from there, when you create the clinic, you always associate it with those 3 layers, which is county jurisdiction, organization provider, and venues. With that, I'll turn it over to Sue to kind of go over that entire flow.
Great. So we're here in the, we've gone to counties and jurisdictions. We've navigated down through the organization and provider, which is the Prince William Health District Manassas, and then we're going to add a venue for that. Down here, that is an existing venue, so I'm not going to add that one. But at this venue, I'm going to add my second dose. Oops, I keep doing that. Second dose clinic. It's always hard to type when people's eyes are on you, isn't it? Okay, so that's the second dose clinic in Manassas. 1,000 Prince William Parkway, Manassas. Don't know the zip code out there, but I'll just do my best. 24159. We'll see if that's an actual zip code. It will tell me. VA. And going down to create venue, that will pop me up an error list if my zip code is invalid. So let me just see if I 23138. Like that. Yep. All right. I will go ahead and do this somewhere. Let's see. Easy enough. This is why it will be handy. 20111. Very good. Thank you, Google. 20111. Let's see if that works. And it does. Okay. Second dose clinic in Manassas is there. And now we'll go back to clinics. And we will look for Prince William. And, oops, clinic listing. No, we're going to create a clinic. Sorry about that. The phone ringing got me a little off kilter. All right, so we're going to create a clinic. It's going to be a COVID-19 clinic. It's going to be private. We're not going to take insurance. We're going to select COVID-19 vaccination. And let me just stop there because I currently am using Chrome. So I don't have any issues with this, but I tend to select vaccination and COVID-19 vaccination. So I'm good to go. I'm open to all ages for now. We did this in Prince William. We did this under the Prince William Health District Manassas. And now you should see two venues that we just created. The second dose clinic in Manassas and the Prince William Health District in Manassas. Okay, so create your venues first under counties and jurisdictions, then come into clinics and create clinic. Please get the setting as close as you can. If you're hosting it and it's your vaccine, it's a health department setting. Okay. Let's go ahead and schedule this for Saturday, 9 to 5. Go over the address. I could add another date. Maybe we're going to do this on Sunday as well. And I could continue to add dates here and adjust the start and end times as I need to. Appointments are going to be optional. My social distancing, I'll continue to just drop 5 in there. My registration deadline is going to be Saturday, and I'm going to allow registrations on the same day. My encounter is going to be 15 minutes. This is going to be a big clinic. We're going to have 10 vaccinators, and additional clinic details will be maintain social distancing. And then you can select your lead staff if you want, or you can simply put in okay. And the vaccinations we're doing here today are Moderna. And I'm creating a clinic right now. If I happen to know I've got vaccine available for this clinic to take, I can go ahead and search for it. Thursday 121, you'll notice when I pull that lot number up, it was created for Fairfax. So I would, if I were actually doing this, I would stop here and make sure that I had clinic inventory allocated to the venue level. And I'll show you that in just a minute. But you can still bypass this. It will tell you, hey, now this is not kosher. Do you still want to continue? But it does allow you the flexibility of putting that in. You do have to say how many items you're taking out of the inventory and putting at this venue, at this clinic venue. So we'll do 150. And I'll go ahead and submit that. And I've successfully created a clinic and allocated vaccine there. So let's take a look at Prince William, just so we can see that I've created the clinic. And you can see the second dose clinic there on the first line. There's 2 of them. There's one for Saturday and one for Sunday, and there's nobody registered for them. And if I don't have anybody registered and I want to delete, I can go ahead and delete. It says, are you sure? And if you have registrations there, it's going to tell you you can't do it. You need to stop because you've got registrations, and that makes you go handle the registrations before you can delete the clinic. Okay, so let's allocate some vaccine to my clinic that I've actually received for Prince William. We received it today. We're going to type in Moderna. We're going to take that. We're going to give it the lot number of Prince William Health District 121. We're going to take 335. That's not the right number, but that helps it stand out for me. And other in the county and jurisdiction will be Prince William. Organization will be the Prince William Manassas. The venue will be the second dose. And the EUA date is December 20th. And now let's go ahead and create that, because as you see, I have created an item up here. I have allocated it all the way down to the venue level, okay? So I'll just stop here and create that. And I've successfully added that. So then we can go back to clinics. Actually, let me just run down here and make sure that I can see my items. Sorry, search by Prince William. There we go. Didn't take it for some reason. Prince William, there we go. Organization and provider, Manassas. And let's just search there and see what's in the system for Prince William. I gotta scroll down. And you'll see that on 121, we received a lot number of PWHD 121, and I entered it and it was 335. So you'll see that that's a nice way to check that you got what you wanted in there before you go to use it. You have a visual, and then you can edit if you need to, okay? All right. How am I doing with what you need? Am I hitting it? Okay, let's go into our clinic activity for Prince William. Go ahead, Nathan.
So I think one other question in there that I saw, are the appointments 10 minutes and are there X number of treatment stations? I think if you can emphasize the section down there which has the appointments and the kind of a throughput calculation in there.
Yeah, let me go back. When you are in appointment information, it is going to read the date, time, and location. Let me just do tomorrow. 9 to 5 is good. The estimated encounter length. So the drop-down list, you do have to pick from the drop-down list, but it's 1, 2, 3, 4, 5, 6, 7, 10, 12, 15. So they've kind of based it on some sort of information that we know. I know that our throughput for vaccinations runs between, if it's flu, it's a little shorter than 10 minutes, but generally a vaccination encounter can be 10 minutes or so. I usually go with 15 if it's a new to me clinic, because I don't know how that cadence is going to be. But if you're quite certain that you want to bump it down to 10 or even 5, because you've got a rhythm going and you know what your throughput is. But this is the estimated length of encounter is really what drives some of the appointment creation. So clicking 10. So if there's 10, if an encounter is 10 minutes, a vaccinator can do 6 of those an hour. And I have 10 vaccinators. So 10 times 6 is 60. Times an 8-hour day is 480 appointments. Okay.
So it is a little confusing. Is that what appointment slots is? It's basically the vaccination state.
Right. Appointment slots per encounter length really translates to how many vaccinators do you have? Did that answer the question? I didn't finish this Create Clinic, but I can if you'd like to see it again. Okay, are there any other questions, comments?
I think a few other questions that we can take that I see in the queue here. I think Dan had a question on the check-in process in itself. So there are two ways to really do this. You can always activate the virtual queue that Sue went over, and then check people in as they arrive at your clinic. I think one thing to keep in mind really on the check-in process is really depending on your audience. If you think that you have a lot of people 65 and over and they're not necessarily bringing in their cell phones with them, and then you start activating the virtual queue, then they're not going to get notified as you go through the virtual queue. So they're not going to click the link to check into the appointment, and then you can kind of mark them as click on the link in the virtual queue to say, yep, I invite them into the clinic, and then mark them as arrived. So the check-in process, if you're using the virtual queue, the only caution against that is making sure that your audience or the people who are going to be showing up at the clinic, have cell phones, will, bring it with them. So something to keep in mind. For the check-in process. Other than that, systematically speaking, you can go ahead and start vaccinating individuals without activating a virtual queue. So if in the system itself, I think if you want to be able to use the system functionality to do a check-in, that would be the virtual queue. But otherwise, if you have a process that's outside of that where another system that's in place, you can use that, have them come into the clinic, and then start doing your appointments. So I think you have a couple of options there, either the virtual queue or you already have something in place where you can kind of do some crowd control. One additional question that I see in here is talking about the capabilities each role has. Sue, I don't know if you have this handy, but if you can bring up the colorful chart. So if you look in this chart, I think it'll give you a good overview of all the different functions on the first column, and then what each person is able to do. Looking at the overall construct, I think the biggest thing to understand is you work within the context of your three distinct layers, which is the county jurisdiction, the organization provider, and then the venue. So to us, it translates to the health district, the local health department, and then the venues within the local health department. So if you're a local admin, then you're at the county jurisdiction level. Like Sue mentioned at the start of the call, you're essentially a super admin or somebody who can essentially do everything in the system, but very specific to your particular county jurisdiction, so your particular district. The only caveat there is that you cannot add other admins, you can add other users. So if a local admin has to be established, it has to be either done by the regional admin or the super administrator. But other than that, as a local admin, you have the flexibility to pretty much do anything in the system for your particular county jurisdiction. When you go down to the venue admin layer, then again, similar to what we talked about, with local admin, a venue admin has a lot of control over their particular venue. So they can add other users who are going to be supporting their venue and make them staff or lead staff. And then they can edit clinics within their within their venue. They can create clinics within their venue. They can look at registration lists, so on and so forth. So I think one of the things that we did in the staging environment is we used our other email addresses to kind of look at the different roles and see what, and look at what you actually see within the system. I think broadly speaking, if you go to the clinical listings, for example, as a local admin, then you look at every clinic listing that for all clinics that fall under your district, versus a venue admin, you'll only be able to look at clinics within your venue. So I think that premise kind of translates across the board into even something like inventory. As a local admin, you can see inventory that's available across your entire district, versus a venue admin, you'll only see what has been assigned to your particular venue. So that concept kind of translates across the board. And I think if you, I would highly encourage you to kind of, take another email address in the staging environment and, use that to kind of give yourself these different roles just to see what it looks like. Okay. Are there manuals that we can look over? Yes, absolutely. PrepMod has a set of user manuals that have been published. They are very detailed and comprehensive and will take you through all the different functions within the system. There are also job aids. I believe those links were included in the deck that we had provided yesterday. Is that right, Sue?
They were included, I thought, in the email. Let me just.
Okay. We can check to see where they are, but they should be in the.
Oh, they're in the deck. Yeah.
They're in the deck. Okay.
Yeah.
So we can we'll take a note to share the location to those resources. They've been posted on an internal VDH site, so you should be able to access them from there. We'll definitely get the link out after this call.
That was from yesterday's local health district meeting with VDH that started at 9 o'clock. It's that deck. So if you've already received it, you should look through that presentation and you'll find the links.
Awesome. Thank you, Sue. Another question in here. If you selected seniors, would it kick out anyone trying to register that was younger than a senior? That is not true. I think it's more so a designation that is provided to the clinic, but systematically there is no rule that prevents somebody else from signing up. I think it's really just an indication at the clinic level. There is no business rule in the system that stops somebody who's younger than 65, 60 to register for that particular clinic. Next question from Kevin, which is, can you summarize what type of reports can be generated that are diverse information needs for people involved in pods? I'm curious what we will be able to do with PrepMod that was not possible in VAMS. So I can quickly, if I can share my screen, I can quickly kind of walk over the different reporting functions. And great question. I think this will be good to kind of see. All right. Can I get a quick confirmation that you're able to view my screen? Okay, wonderful. All right. So a couple of things in here from a reporting standpoint. So the first one, you go into registration list. You are able to download the registration list. When you download this list, this will give you, and I'll go ahead and download this one just as an example so you can see it. You will be able to see all the patients who are registered at that particular clinic, and it will also provide you with columns that call out the responses that they had provided to the different health screening questions. It also includes their demographic information. So just to kind of give you a preview of what it looks like, it'll download a spreadsheet like this. It'll have all the patient's information, the vaccine that they requested, the response to the different health questions, and all the other information that they had submitted along with their registration. So this is one item. The second piece is if you go into the customized reporting module, this allows you to do a couple of things. You'll see that there are 3 different options in here. You have a clinic report. Within the clinic report, these are preset functions. You can kind of choose what you see, but you can, decide to, click on all of them and then download a report that's like a comprehensive clinic report, or you can choose to see just a registration list, which, you can also download from the registration list under clinics. Or you can come in here and choose to see the registration list. You can look at all the clinic details that are in here, being able to pull out all the private clinic URLs. You can look at the patients who've registered, the total who've been vaccinated by clinic. The other view that it gives you is a patient level view. So you can sort by, those who've been registered or those who've just been vaccinated, and then you can choose the information that you want to see associated with that particular patient. Now, one important piece that I will call out is the same structure that I was talking about earlier that you'll kind of see translate to a lot of areas within the system. So the county jurisdiction, the organization provider, and the venue location. As a super user, and I believe I'm logged in as a super user, I can go ahead and select all the counties, all the organizations, and all the venues that are in there and produce the report based on the data points that I want to see, right? Let me just get rid of this. If I was a local admin, then the only counties that you would be able to choose is the counties that you are a local admin for. So the county jurisdiction really translates to the health district. So if you are a local admin for Arlington, you'll only be able to see information that ties to Arlington. If you are a local admin across Arlington, Blue Ridge, Central Shenandoah, you can see it across all 3 places. Organization provider, of course, based on what you choose, the options will populate below. Let's assume that you're a venue admin for Arlington County Public Health, and you are a venue admin for Sequoia 2, then you'll only see Sequoia 2, you won't see the other 2 venues in there to generate your reports. So I think that premise kind of applies to customized reports, inventory, just the level of access that you can view within the system. You can go ahead and download these. Reports and then work with that data. They're all produced on, essentially produced on spreadsheets. But those, I think, are your 2 main areas where you would be able to download and kind of look at some of the reporting functions that are within the system. Kevin, I hope that gives you a view into what type of reports there are. Again, I would encourage you, in the environment, to just download a couple and look through the different data elements. I think based on the headers, sometimes they have a lot of information in there, but I think the headers should be fairly intuitive to be able to understand what those are. And if you have questions, definitely let us know. Okay, I think I see, and we'll try to do a couple more questions real quick. I see a question from Dan. When setting up a clinic, if you add a clinic in with multiple dates, does it create a separate registration link for each or just one for the overall clinic? The answer is it creates one for each clinic. The way PrepMod does it is if you enter that you have a clinic operating on Monday, Tuesday, Wednesday, then it breaks it down to 3 different clinics within the system tied to a particular date. They will have their own separate registration links. That is true.
Nathan, can you go back up and answer Delilah's question? I believe the answer is we're still working on a process for this, the actual scheduling of a lunch break to keep people from registering between, say, 12 and 1 o'clock. I've tested this a little bit, and I haven't got all the way through it.
Right, that's right. Based on what we know at this point in time, in VAMs you can kind of designate clinic absences. I don't believe that there is something similar in PrepMod. I think we can definitely take that back to the vendor. And I apologize. I missed that question.
Yeah, that's okay. I did play with that a little bit, Delilah, and I had tried to schedule for the same day, 9 to 12 and 1 to 5, and the system kicked it back to me, and then I started training. So I haven't finished working through that process, but we'll take that back to the vendor, as Nathan said. We're at 3 o'clock. I don't want to keep people over. Thanks to everybody who attended. I think we have a couple more questions that we didn't completely answer. So we're gonna, I will kick out an email to everybody with a response to those last couple of questions, if that's okay. And I thank everybody for your time and everything you're doing on the ground. I know it's not easy. And hopefully PrepMod, once we get everybody on it, will be helping us move quickly through the vaccination queues that we have. So thank you for everything you're doing. Have a great day, everyone.
Thank you, Sue.
You bet.